I'm going to now show you how to use the MyoTool to treat sciatica. Or medically, we're going to really call that radiculitis or radiculopathy. If the patient has back pain and unilateral leg pain going down below the knee, it would be considered part of a sciatica diagnosis. The patient can use the MyoTool. Let's say in this case we're going to treat the left side by putting the MyoTool onto the left side, and then she lies down on it so that the end knob is over the left L5-S1 facet joint. She knows she's on it by lifting. If I have found that in prone exam with my unilateral PAs, then I show her how to find the spot, and she's right there. Perfect. That's L5-S1, and she mobilizes by lifting. And while she's lifting in that position, she's creating a specific PA force on the left L5-S1. So she may move that, and it may bring on some of her pain, maybe even a little bit of lateral thigh or posterior thigh pain. It's okay if she brings on pain as long as she mobilizes, she continues to see the pain ease and centralize. We do not want any peripheralization of symptoms. Maybe a few minutes of this, she then stops, takes the MyoTool out of the way, and reassesses her straight leg raise. And maybe to protect her back, this back leg will be bent, and she does a straight leg raise to see how far she's raising the leg before the onset of symptoms. If we are now to the point, and under direct physical therapy supervision, she is then given self-mobilizations of the nervous system, she will do specific treatment of the neural tissue by doing hip flexion. The next sensitizing movement of a patient with adverse neural tissue dynamics would be hip adduction. She may mobilize this way. If we want a little bit more stability, we could extend the bottom leg or the outside leg, and then there's the hip adduction. And the last or third sensitizing movement could be internal rotation by just turning the MyoTool the way that the foot sits between the knobs and the end. She creates an internal rotation mobilization. All these are movements that increase the sensitivity of the nervous system. And lastly, she may even come farther out and create more dorsiflexion on the foot, further increasing tension. She spends a few minutes doing that mobilization, takes the MyoTool away, rechecks her straight leg raise to see how far she's going, and if she sees her toe going higher on the wall or the ceiling with this treatment, just a few minutes of self-mobilization techniques with the MyoTool can improve and maintain mobility of the sciatic nerve. Thank you.